The key to all of this is reforming entitlements, and it hasn't been discussed, or it doesn't have enough specificity at all on either side for us to know how that's going to work. One of the big risks is that even while I would make the case that you have to have all parts of the budget and revenues have to be a part of it, it's easy to get a lot of revenues quickly, but it's hard to get these entitlement savings quickly. And that's the real problem in the budget, and that's why the Obama budget doesn't stay stabilized for long at all, because they don't do the reforms on entitlements. Social Security.
And I would add, by the way, it's also why Romney's plan not to touch anybody who's 55 or older doesn't bend the curve at all in the first 10 years of the window.
The whole promise not to touch anybody 55 or older, I understand the politics of it, but it means we miss all the baby boomers where we could be getting some savings from the people who don't need it. On Social Security, we know how to fix it. There's 5 moving pieces. You put them together in a menu. It really isn't that hard. We should be doing that one as quickly as possible. And every year that we don't, it ends up costing a whole lot more because of the wasted time. Healthcare, it's really interesting because we don't know the answers. Basically, what I think we're going to see, and what we've already seen, is different approaches to trying to cap healthcare spending. On one hand, you have IPAB, which kind of caps it and creates a default. On the other hand, you have a premium support method that puts a cap on it. It doesn't say how you're going to stay under the cap. They both make it sound like it is easier than it really is. I think those are the necessary first steps. We're going to have to put a budget on healthcare. It's going to have to be part of the budget. But the real trick is going to be, what are we going to do to the delivery system and to the incentives in Medicare and Medicaid to keep the cost within those caps? And we're going to continue to have to do healthcare reforms over and over and over again. Thereby, my advice is do absolutely as much as we possibly can right away, and we know it still won't be enough. And this is going to be a constant rejiggering. Technology is creating more healthcare that we all want and we want to spend money on. But I do think the plans, both sides, are sort of putting a cap on it and not filling in the details how you stay within the cap, and then they fight about it for an awful long time.